All right, so we're talking about analysis of the ECG, and we're at the point where we're speaking about looking at the QRS complex, and we said that we can approach that with an acronym QRS plus. All right, we spoke about Q waves, how they're formed, or how physiological Q waves are formed, and how we can determine that Q waves are physiological, and what leads we expect to see physiological Q waves in, which would be the lateral leads and sometimes the inferior leads. Okay, at least more commonly. So now we're going to speak about R wave progression. So what is R wave? Forgive me. Anyway, so what is R wave progression? So R wave progression, and this is just me cooking up a definition right now, right? But R wave progression is the normal, gradual increase in the positivity of the R wave as you go across the precordial leads. So the R wave should initially be small, right? Let me get the pointer. The R wave should initially be small, right? V1, then V2 it's a little bigger, V3 it's bigger, V4 it's getting pretty big, V5 and V6 have nice tall R waves, right? So not only does the R wave get bigger, but the S waves get smaller. So that's what R wave progression is, and this is an example of normal R wave progression, right? So the transition point in a normal ECG is around V3 or V4. Okay, and abnormal R wave progression, right? Well, there are different types of abnormal R wave progression, right? But as it relates to ischemia or old infarction, right? Abnormal R wave progression is when V3, the R wave in V3 is less than 3 millimeters or 3 small boxes. So what we're saying is if the R wave is really short, right, meaning it's not progressing normally, it's taking really long to reach to the transition point, then that's abnormal R wave progression. And that's all we'll really say about that for now. Many different conditions can cause abnormal R wave progression, so it's not limited to ischemia and infarction, right? However, I'd like to take a second to explain the physiology behind normal R wave progression. So this is an illustration of the precordial leads on the chest. So we have an AP illustration, and then we have a cross section showing the heart inside the thorax and where the leads will be placed. So the normal mean electrical vector of the heart goes from the right side to the left side, right? Okay, and we can illustrate that on this diagram as well. So what we're saying is, even though the impulse starts way on the right, and initially it will be going towards these leads like V1 and V2, by the end of this vector, it's actually going away from these right-sided leads. And that's why, or that's at least part of why, you would get an initial R wave in these leads and then a big S wave. Because remember, negative deflections mean that the impulse is going away from the lead. So that's what's happening right here, right? So as you go more laterally, more to the left, like V6 and V5, the impulse is just coming from the right to the left towards the lead. And so they are predominantly, where's V6? Right, they are predominantly positive. So in a stepwise fashion, we can see as we go from right to left with these leads, we should be getting a gradually more positive vector. So that's basically it. That's what, so we're saying if that's what's happening, we're expecting that this heart is having pretty normal conduction, pretty normal progression of the mean electrical vector across the heart.